You know, the beauty of ADHD is it's the most treatable disorder in psychiatry. There is no disorder that we treat that has as many medications and as many psychosocial treatments that are as effective as these are for as many people, producing more change than any other medications and psychosocial treatments for these individuals. Do you know that 55% of people on medication are normalized? 90% of them respond? Do you know that the effects of ADHD medications are 3 times that of anxiety drugs and antidepressants that you all give away like candy in your practice? We have huge effective drugs on our hands here that we can use. And we also have very effective psychosocial interventions. This is the most treatable disorder that we face. All of this in ADHD is due to neurogenetic deficits. And that means that medication is absolutely justifiable. After all, if you have a neurogenetic disorder, then neurogenetic therapies have a role to play in your disorder. And they do. 80% of people with ADHD will be on medication at some point in their life. And good thing. It's the most effective thing we have. There are other things we can do, but that's the most effective. Now, you might be able to train up some of these executive functions. We don't know that yet. We don't know whether practicing working memory actually helps you in life. There's no evidence that it does at this point, at least convincingly. You need to understand that medication is the most effective thing we have. And that doesn't matter to me whether you like that or not. That is a statement of fact. We have no more effective interventions than these medications, which is why in the last decade we have moved them up in our priority of using them. It used to be that we would try everything else under the sun first, and only if they failed, go to medication. Well, guess what? 80% of them failed, and we went to medication anyway. And we should have started with it to begin with, because it would have made them more amenable and more susceptible to the other psychosocial educational programs we were trying to do. So don't be surprised to learn that up to 80% of ADHD children will be on medication at some time in their developmental period, whether that is childhood or adolescence. Because there are times and places where you cannot institute a psychosocial treatment. If your child is driving home from the homecoming last night, which was over at the Delta Hotel, by the way, I checked in and there's a prom going on. You can't be there handing out tokens for following the speed limit. You know, this is idiotic to think that behavioral interventions are as good as medications. They're not. Where they're done, when they're done, they're good. But there are places where they can't be done. And now what do? The medications fill those gaps. So that's why we use them, and that's why you're seeing medication on the increase in both of our countries. And it is completely rational to do so. The biggest problem is most people don't get treatment. 40% of children and 90% of adults with ADHD are not recognized or treated for their disorder. That's the problem. Not that we're over-treating. We are under-treating. And we're under-treating the most treatable disorder in psychiatry. Thank you.